Hi, everybody. I think you should be joining us live. We're going to give everyone a couple of minutes just to settle in. I think we've got lots of stuff going on for you today. So we are going live on Facebook and on YouTube at exactly the same time. I can see there are 49 people watching us already. I can see pop up on this. It's mental. We're just watching all the comments coming through from everywhere at the moment. So I think everyone on YouTube is probably going to be a couple of minutes behind everyone on Facebook. So if you are here on Facebook, I'll give you a quick rundown and I'll go through some bits and pieces about YouTube as well. If you do have any burning questions you always wanted to ask myself or the lovely Mr. Taylor Green, then you can always pop them into the comment section below. Same for you guys. If you are picking this up on YouTube, you can put some comments in the section below and we will pick up on those as well. The lovely Mrs. B is behind us here and she's popping all of your bits and pieces up on the screen. So we got hello from Georgia. Tisha saying evening, bye. Hiya, Tish. We got hello, gents from KY. Hello, KY. How are you doing?
Town.
I know there are so many people. Hello from Cape Town,
New York City, Virginia.
My goodness me, there are so many people online at the moment. This is absolutely fantastic. I'll let Mr. Taylor Green introduce himself a minute as well, because I don't know what we're talking so fast. You carry on, Mr. Taylor Green.
I don't know what to say. No, but my name is Taylor Green. As you all know, I'm one of the audiologists here. I'm not sure if any of you was in here, was in the Instagram live just now, but it's a little bit different this time. We can actually see the messages coming in this time.
My goodness,
we couldn't see the messages in the last one.
We were struggling, weren't we, in the last one? We really were. So let's put, so with lots of people coming up on, so we're just going to do a quick rundown. I tell you what, guys, just to give you an idea, I'm going to pop the comments on so you can see what we can see. So what you'll see is these are all the comments that are coming in so far. So loads and loads of people commenting. We're trying to flick between the two to see what's going on. But just give you an idea. So we've got Stephen. I know Stephen the Waxing Lyricist is on. I've seen him on earlier as well. We are going to do a live unpacking of the gift that Stephen sent through to us as well. We haven't seen it. Mrs. B's already unpacked it, just so we didn't fumble with sticky tape. But we haven't seen it as well.
Very still in the box. It's still in the box.
Right. Lots of questions are starting to come in. So let's get into these questions then.
Is Taylor growing a Reese beard? Unfortunately not. It doesn't grow like this. It's
this is epic beardness. This is
it's very patchy. I could probably grow a tash, but I'd look really weird.
Right. So here we go. First question: why don't the NHS do ear action removal anymore? Any idea? It's probably a high probability of hearing problems. I think it varies so much from area to area. Here in Wales is a bit different to how it is in England, here in the UK. I know in Wales they are starting to bring it back into GP surgeries. It is on the cards. There was a meeting with the Welsh Assembly which we sat in on a couple of months ago now, and they are thinking about bringing it back. In England, it's a slightly different situation because we obviously government with the Welsh Assembly government and you guys obviously government with Westminster, so I think it will probably in some form will come back. There's so much pressure from audiologists to bring it back to NHS services. I think that's what will happen.
I was going to say, I've got friends who live in England and they're saying exactly the same. GPs are not doing it at the moment. I have no idea why, to be honest. We've heard so many different like rumors, really, more than anything, but no kind of definite as to why they're not doing it.
Don't forget, guys, if you've got a burning question or ask me and Mr. Taylor, lovely Mr. Taylor, I should say, pop me into the comment section on Facebook and YouTube. They will pop up. There are loads coming in, and Mrs. B is in charge of the questions. So, hello, I don't get earwax, but very itchy since I was a child. Is it normal? Yes, it could be possibly that you just have a little bit of dryness to the skin in your ear canals. You're just on the channel talk about olive oil all the time. Use olive oil on a regular basis. Every couple of weeks will be really helpful for that kind of issue. If it doesn't improve ear calm, probably. Yeah,
depends on the condition, really. I mean, if you've got eczema, you're quite likely at possibly getting it in the ear as well. So that could be one of the reasons.
Worth getting somebody to take a look. If you can't get into your GP, you can always speak to an audiologist and one of us will take a look for you. We can give you some advice from there, but I would imagine just try a little bit of olive oil to start with. It's not going to do your ear any harm, but it would help with some of that itching you've been getting as well. So
travel down, we'll take a look.
Why not? Why not? From Abby Paul on YouTube, question, Mr. B, what is your tattoo? I can't figure it. It looks awesome. It's a nautical scene, so I've actually got a kraken and a ship and
Take your top off. Come on, take your top off.
Nobody wants to see that, I agree. Nobody wants to see that. No, that'll do. There you go. So I don't think, there you go. So you can see it's a crack, and there's lots of bits and pieces of tentacles. There's a ship up there as well. There's a lighthouse under there. There's a big Poseidon up there. There's all sorts going on there. It's not quite finished yet. I've got a few more sit-ins left to do, which I haven't booked in this year, so I'll get on with that as well. I think my tattooist is probably on here. Look at this as well. Is there any way that we're going to allow you folks to give people any kind of numbing medication or pain medication for your procedures, or is that just going to be like that forever? And that's from Karen's Crazier Sister on YouTube. At the moment, there isn't a way of us doing it because we're not allowed to prescribe. There is a top-up you can do to our qualification, which will allow you, or the top allow us to prescribe. The difficulty is there's not many people doing it, so trying to get someone to mentor you and shadow you is really difficult when there's not many people out there doing it. Yeah. Go on and take it.
Did a fascination with earwax cause you to decide to become an audiologist?
That's from Wilma Adams.
From Wilma Adams. No, to be completely honest with you, because earwax, I don't know if the courses have changed in university, but earwax removal was not part of the audiology degree. Yeah, that's a separate course altogether.
Yeah.
But in answer to your question, no, it wasn't. I just kind of fell into it, to be honest with you.
Well, the earwax.
Earwax, yeah. Just kind of fell into the earwax. No, I was actually in optics before, not an optician, but I was an optical dispenser before I was an audiologist. And I think my boss at the time just got fed up of me asking questions, so put me on the course.
Fabulous.
Here I am now.
Go on, I'll do this one. So for several months, I've had a sensation like a moth fluttering in my ear. Any idea what it was? It stopped eventually, but now my daughter has it. From Anna Braid on YouTube. You can actually get it's almost like a spasm in the behind the eardrum. You've got two little muscles like a pull tight. That can sometimes go into spasm, and it can cause the eardrum to almost like a rumbling. Some people describe it as, or like a fluttering inside the ears. Other people describe it as, and that can be the cause of it. But it will come on really quickly and something. A bit like if you get a twitch in your eye and that goes on for a little bit, and you'll have for a couple of days, it'll disappear. Similar kind of thing. So it does happen.
Yeah, it can sound like a bang sometimes. Yeah. I've actually had that myself, and it just kind of goes bang, 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 bang. Yeah. It's not nice. Yeah. I've only ever had it once, so it's
it's not nice. Cheryl Lynn from YouTube said, which is more dangerous, canal or middle ear cholesteatoma? It's a difficult one to call, really. I would say probably middle ear cholesteatoma is probably a little bit more dangerous than an ear canal cholesteatoma. Obviously, if both of them treated, both are quite dangerous if you leave them and treat it for a long time. But I would say probably middle ear cholesteatoma is just a little bit more dangerous because you've got a little bit more scope for it to sort of burrow its way for one of it up to you.
Yeah, you sometimes see it kind of coming from where the eardrum is as well. So it's I would have said the middle ear as well, but both will need assessments. Assessments.
Most definitely.
Something in the lifetime. I find this one fascinating.
Okay.
We can't keep up with all these questions.
For Mrs. B, what is Morris Mash? Morris Mash. This is going back a long time now. We're talking about Morris Mash. This is from Kate Smith in YouTube. This is a bit of a personal joke to me, Mrs. B. This actually made it into our wedding vows. Mrs. B makes the most amazing mashed potato. I can't do it the justice it deserves. Honestly, it is amazing.
Cheese in it?
No. You got Mrs. B bolognese, isn't it?
I actually got fed by Mrs. B today, to be fair. Spaghetti bolognese.
But the mash is just beyond. It is awesome mash, and that's what Morris Mash is, guys. It's my name for Mrs. B's mashed potato, which I love. Very nice.
I do like mashed potato.
It's amazing. We'll have to do so. It's just awesome.
A few people have travelled from other countries to be treated by you. Is it still surprising to see people wanting to travel to get treated by you?
That's from Modest Foster on YouTube.
Yes. It's surprising the distance people are willing to travel to come and have an appointment with us, to be honest. Because I think in the UK, my furthest appointment I've seen is Brighton, which I think is about correct me if I'm wrong, about a 4 or 5 hour drive.
Yeah, it is.
Which is quite a drive, and I mean, Wales is quite a small. Great Britain is quite small compared to America and Australia, and so I'd probably say about seven hours. You could probably go from one end of the country to the other. and make it to Scotland.
That's right. I think it is surprising. I had a lovely lady come over from Canada to see us. I had a gent last week that came from the other side of London as well to come and see us. Well, so I always feel really kind of humbled when you see somebody coming along and they've travelled all that way to come and see you, and it's lovely. I always think, oh my goodness, this poor person's travelled all this way to come and see it. But it's it is lovely to see it, and it's good to see that the reason we started the channel was to promote good ear health and to promote what people should be doing in ear canals. And I think it's really lovely to see that is actually hitting home, not just in the UK, but everywhere. It's just absolutely fantastic. Yeah, thank you so much for you guys subscribing and pushing the channel as much as you do it, and it makes a massive difference to get that lovely word out there about hearing and hearing health as well.
Yeah. We've got Maine, USA in the house. Hello. We've got Michigan.
Oh my goodness me, there's loads of people on here today.
Is anybody in Wales watching?
I did see one come with video. As well. I'm in the US and I have tinnitus in both ears, and because of other health issues, I don't know if I should see an audiologist first. From Mary Beth Sutton on YouTube. I personally would say yes, it is worth seeing, because there can be, tinnitus is such a big sort of ball of lots of different things that could be contributing to it. So definitely get an audiology perspective would be a really big help.
Oh yeah, definitely.
Most definitely. Cool. We've got another one. Good afternoon, Reece.
Good afternoon.
From Belia1313 last days, I want to say, or last days, I like it.
Good afternoon.
Hello from Maine, USA. I've been to Maine. There's not many places in the US I've been to, and Maine is one of them. I didn't get out of the plane though, because it was refueled in Maine.
One of my best mates done a season in Maine.
Yeah.
I used to work on a campsite in Maine. I think it was like a
nice.
Yeah, I don't exactly know what it was, but yeah, it was
sorry, let me give you San Diego, California.
San Diego.
My son-in-law's in California at the moment. He's working over there. That's from Margie Grant.
We got Vela Glamorgan in the house.
Oh, there we go. We got somebody from Wales.
We got someone from Wales.
What else have we got on here? Let's have a little look. Question from Phil. Oh, hi, Phil. Phil's a really long-standing.
Oh, I recognise the name.
Question:
Hi, Phil.
My husband can have out of the blue talk very nasally. Had his ears damaged by a concert of AC/DC. Can that be related? I'd say if he was talking very nasal, probably not. That sounds more like a physical change somewhere. Sometimes it could be an indication of enlarged adenoids, so it's like puffiness at the back of the sort of the nasopharynx and the soft tissue at the back of the nose. So I'd certainly say it sounds more like that. It might be worth definitely getting an assessment with ear, nose, and throat for that as well, just to check out if he is talking quite nasally, because it could be like even when people get allergies and stuff like that, you get this kind of rhinitis. It makes you sound quite nasal. So yeah, get the game.
Speaking of AC/DC, I've always said if we made a band, I'd call us ACBC.
Oh, I like it.
Just
Look at that.
there.
Seamless plug there. Taylor's new band ACBC. Wilmer Adams on Facebook said, I had maxillofacial surgery several years ago. My right ear has never been the same. An auditory test exam was fine, but my ear feels blocked and sometimes a whistling sound. I was told it's tinnitus. Are there over-the-counter remedies? Not so much for tinnitus. You don't get really kind of over-the-counter remedies for tinnitus. It would be more of a sort of a full assessment, finding out what is going on as far as those ears are concerned. We said the ear exam is fine. You can get spontaneous tinnitus, which will just develop. The best bit of advice we can give to anybody who has tinnitus is try not to concentrate on it. Try not to listen out for it. Because it's almost like a glitch in the filtration mechanism inside the ear, or the brain, I should say, sorry, which causes us to pick up on the tinnitus. So, by doing that, it helps to sort of drown that out or push it to the background as it should do.
Sometimes the medication could cause the issue as well.
It can be a side effect medication.
Yeah.
If you've had it since the surgery, it might be worth speaking to you're going to a GP if you're in the US or if you're in the UK, just to see if there's anything that can be done to help it out a little bit if you get it after the surgery. Yeah, definitely. Yeah. Susan Perry from YouTube. Maybe it's from Tredegar. That is literally over the mountain from us, so it's not too bad. Congratulations on your 1,000 episodes. Thank you very much, Susan. It's always nice to see somebody who is a bit more local. My right ear always feels blocked for many years, but it is clean. I have a slight sinus problem right side. What could that be the cause? Debbie S. What's that? I agree.
So I'm going through the question again. Sorry, I'm a bit slow. Sorry. My right ear has always felt blocked for many years, but it's clean and a slight sinus problems in the right side. That could you could be looking potentially at a eustachian tube issue. It depends whether you've had any issues with fluid building up in the ear or glue ear, we call it. You can get changes in pressure. Yeah, I mean, again, we would say, you know, if you haven't had it checked, get your GP to refer you to get it looked at. You know, there could be a fix for it. Could be a remedy.
Yeah, most of these things, these sinusy kind of things, there's usually a fix out there for you. Yeah, we'll get that done.
Love this one. I'm really interested to see how you answer this.
Right, we've seen. Oh, this is one, Mons Foster. We've seen many challenging roles from your side that take a lot of effort and arm muscles. What would you say is the most challenging task that Mrs. B has? Managing myself and dealing with me, probably dealing with us on a day-to-day basis. In fairness, although what you see on the front end is all the audiology stuff, we couldn't do that without Mrs. B managing the back end, and Mrs. B just basically everything that isn't audiology front of house related gets managed by Mrs. B. So we couldn't do what we do without Mrs. B doing what she does, and Mrs. B is exceptionally good at what she does. So I would say nothing really phases Mrs. B too often, apart from the Instagram live we just did, because that went all sorts of wrong. That was carnage. But organised carnage. Yes, organised carnage. But yeah, I would say that's probably managing that slot is the worst thing just it is.
My daughter has her ears cleaned by irrigation twice a year, but often ends up with an ear infection afterwards. Is there a way to prevent that? Could be ear calm. It depends. Again, if some of that water is getting trapped after the cleaning of the ear, then that can sometimes cause infections. May just be prone to infections using water. I mean, if you have access to it, I would maybe, depending on the age as well of your daughter, I would maybe query microsuction. If the infections are continuing.
I think if your daughter's getting it, particularly after irrigation, when you use irrigation, obviously we are gently rinsing the ear canal, so you are taking a lot of the natural oils and some of the ear defences out, natural ear defences. What we would normally say to our patients is to use some ear calm, which is an acetic acid spray, prophylactically. So basically you're putting that in after the procedure's been done. It just helps to sort of get the ear's natural defences back up and running quite quickly. So doing that might be worth it if microsuction isn't available, to be able to do that as well. That'll probably be quite helpful.
Yeah.
What else?
We've got loads.
We've got tons coming in. Does being a millennia feel old? Does being a millennia feel... Oh, right, 1,000 episodes again. Right, sorry. Slow it up. Take us some Okay. It feels strange. I never thought we would get to 1,000 episodes. If I'm being perfectly honest, I thought, we were doing it just to try and promote the microsuction and good ear health and things like that. I didn't think there'd be that much of a following for it, but I've been pleasantly surprised. We just hit the 500,000 subscriber mark on YouTube, 1.2 million on TikTok. So there's a lot of people watching videos out there, and the subscriber count's going up all the time. Yeah. So we must be doing something right. That's all I can say.
You guys are both lovely.
Thank you. And I've only been around since around episode 500-ish. I actually can't remember the number of the episode.
I'm not sure.
When I first started.
Does anybody know that out there? Does anybody know what episode Taylor joined us? I bet you one of these people
probably. I bet somebody in the comments will know Taylor's debut on Audiology Associates. You'll have to have a look and see if you can find it.
Everyone's probably going back to it, having a laugh. I'm nervous.
You were nervous. For that first couple of episodes, you were nervous.
I needed new pants after that, to be fair.
My partner uses Q-tips to clean the cartilage portion of the ear canal. Is this a safe way of using Q-tips, Emma Doherty? If you mean just the entrance here and up into this particular portion of the ear canal, that is fine. You could just use a flannel, something like that, as long as you're not going in deep. If you mean you're actually going into the cartilaginous portion, the outer third, try not to. It's because what you're going to do is you're going to strip all the oils, the natural oils from the ear canal. It's going to cause that wax to get far drier, and it's going to cause more problems with their wax. So I would say, if you can get away with it, just clean at the very outside, what you can actually physically see here in this part of the ear as well. So your turn.
How can you tell if it is safe to use irrigation or olive oil if you can't see the eardrum to see if there's a perforation? That's from Stephen.
Oh, Stephen the Waxen, the lyricist.
Hello, Stephen.
Hello, Stephen.
To be honest, if someone is unsure, we'll just use microsuction.
Yes.
Keeping it plain and safe. until we can physically see the eardrum and we know it's intact and we know there's no issues, then we can use it. But we generally tend to use irrigation only on really soft, wet, kind of like mushy, kind of like sticky wax. It literally takes like seconds.
We take a history from the patient as well. We always ask them, is there any history of perforation, ear surgery, and anything like that. If that is the case, they always go straight into a microsuction clinic. It might be actually a good opportunity, because this is Stephen the Waxing Lyricist. We've actually got your parcel you sent to us over here, Stephen. So should we do that now? Come on, let's do that now. Okay, so this got sent by Stephen the Waxing Lyricist. We've never actually opened it. This is Beat opened it.
To everybody about Stephen.
Yes. If you're watching this on Facebook or if you're new to YouTube, Stephen, we do the 12 days of wax. We do wax event calendars over the last couple of years. And Stephen, for the last few years, has actually been putting all of that to music for the 12 days of Waxmas. We actually sung part of it last year for the 12 days of Waxmas, which it's
probably the reason why some of you are still waiting.
So Infinity sent us a lovely gift which we haven't seen. So we said we'd do this live on the live. So go for it, Taylor Green. You can open them up.
Come on, then let's have a look. Let's see what we got.
Yeah, let's open this.
Let's see what we got.
They haven't got a clue what this is.
No, we haven't seen this at all.
This is the first time we've opened it. Live opening.
Taylor and everyone at Audiology Associates, we shall open this in a second.
We have a letter. Do you want me to read this out?
Yeah, go on then.
While you're doing this.
Well, I tell you what, let's do this one.
I'll do this first.
Ah, that's awesome. So thank you very much. It's nice backwards. It's mirrored on you. So everything's backwards. We've actually got some song lyrics. Should we read this out?
Yeah.
Yeah, correct. So self-clean. Pardon. Self-clean, self-clean. The ear is self-clean. Please don't shove things in there that just can't, just because you can. The ear canals beyond compared has a form of self-repair. Migrating skin will take the wax away. This is done without the need for you to help the wax get freed. Epithelial migration saves the day. You should never scratch inside. The canal is just not wide enough to cope with what you want to use. You could push a plug in deep that stops you hearing when we speak. The drum just can't take that kind of abuse, but if an itch does cause you grief, there is a form of bliss relief. With olive oil, you only need a squirt, but don't use if your drum is damaged. If it's been perforated. If not sure, ask a medical expert. Self-clean, self-clean. The ear is self-clean. Please don't shove things in there just because you can. That's awesome. Thank you so much. I'll go in clinic now, Stephen. Thank you so much for that.
That's a decent one.
Oh, that is amazing. Thank you so much.
Do you want to read this out as well, the letter?
Yeah, go on then.
So we've got Dear Reese, Taylor, and all the other lovely people at Audiology Associates. For your 1000th video on YouTube, I thought I would send you a little present for your wonderful achievement. I really hope you like it. I've tried to write it so it's medically accurate in the hope that it might educate the cotton bud users. If you can't work out the song I've parodied, don't worry, I'll be posting the song in the comment section of episode 1000. But if you can't wait until then, here's a clue. It was released in 1973, before I was born. And Rolling Stone magazine in 2014 ranked it at the top 10 of their list of 100 greatest country songs of all time.
Oh, I like that country.
And even higher in their 2024 list of 200 greatest country songs of all time. But before I sign off, I want to say one last thing. This is for all your videos and for putting up with my brand of nonsense in the comments section for the past few years. Thank you, Stephen, your waxing lyricist.
Thank you, Stephen. That's really nice.
Really nice.
Pop into the comment section below. Let us know what you think the song was, the lyrics go to, see if we can get it right. Wrong one.
Sorry.
That's okay. That's all right. Crystal XYZ on YouTube says, I sleep with earplugs to drown out hubby snoring and don't have actual earwax, mostly itching, but often experience tinnitus. Is that normal? Thanks.
Sleep with earplugs.
Well, you could say with putting the earplugs in, if you haven't got any wax, there could just be a bit of irritation to the outer portion of the ear canal, especially if you get a dryness to the ears. So we would say if you're putting earplugs in like that, always make sure you put a bit of olive oil on a regular basis. That's going to help. And the tinnitus, it's not normal, but tinnitus can just suddenly develop in lots of patients. So definitely.
Again, it depends on if you are quite a builder of earwax. I mean, using plugs, usually you would require them to be checked more often, because you may need to have wax removed a lot more often because you tend to see it quite compact. Not quite as bad as what we see with cotton buds, but we do see, you know, the wax being quite flat with the use of cotton buds. But yeah, that can sometimes make the tinnitus sound worse as well if it blocks up with wax.
Yep.
Yeah.
Ooh, what we go next? What is the most disgusting thing you have encountered? Well, that's very Gen Z. I'd say nothing's really kind of disgusting, but some of the more unusual stuff. We've had a string of batteries recently. We've been taking lots of batteries out of people's ears.
Especially on Christmas time that we had. That was,
goodness me, that was tough.
Yeah,
That was tough.
It looked like the battery had actually started to corrode inside the patient's ear canal. It was pretty rough. But generally, ear infections are normally the most disgusting things we tend to see.
Yeah.
I remember there was one case I had. It was quite a nasty. I think it was a fungal infection, and the smell just lingers with you. It really does. It's horrible.
As you know, if you've got an ear infection, it's a very pungent smell.
Yeah.
That you get. Yeah, it's normally an indication. I can see the song is popping up. It's Swig now. It's Jolene. Yeah, there you go. That's what it is. It's Jolene by Dolly Parton. It's self-clean Jolene.
Oh,
I just
absolutely not. I'm not going to put that on anybody.
Have you any advice on itchy ears caused by hay fever? I have no wax, but when it's hay fever season, it drives me bonkers with itchy ears. That's from Kate Morris. There is a spray you can get called Ear Calm, and a lot of patients find that really helpful. I know we talk about olive oil as well, but olive oil can sometimes form a little bit of a barrier on the skin, and that's helpful. We got voices coming from. So that's usually really helpful. It forms a little bit of a barrier as well when you're looking at things like hay fever. So that's usually really good. That's a good one to do.
Yeah, so I think the Ear Calm, I think the box actually says it's for minor outer ear infections or something along those lines. So I know it's not technically an ear infection, but it can help to calm the ears down a little bit.
Question: what are your favorite tools and why do you like them? But also, what is your favorite YouTube channel? From Luna Humber on Facebook.
Oh,
do you want to do your tools first?
Oh yeah, my tool. I think a lot of people who regularly watch knows what my favorite tool is. I'm a big fan of the Rosen inserter. I don't know. I really don't know what it is with the Rosen inserter, to be honest with you. But it's quite satisfying.
It's when those curved lines.
It is. It's the curves. It's the point.
We've got a video coming up soon where we show all the tools.
Yes, we have. You have got a video that's coming up on social media soon, which goes through every individual tool we use. You can see what that looks like. As far as mine's probably the St. Bart's hook. I've a bit of a love-hate relationship with the St. Bart's hook. We're back on again at the moment, so it's one of those things where I've used it a lot. It's been really helpful. But favorite YouTube channel? Mine probably wouldn't be ear related.
No, that's a pretty difficult one because I don't actually stick with just one, to be honest. I mean, there's a lot. I really just tend to watch things like golf and just boring stuff, really.
Screen Crush is mine. I like Screen Crush. Screen Crush is all about films and TV series and breaking down trailers and stuff. I'm a big film fan. I love anything TV and film related, so that's always a good one for me. Greetings from Canada. Hello, Kevin Magda from YouTube.
Hello, Kevin.
My question is, do people with oily skin have more trouble with wax issues than people with normal skin? That's a really good question. I think they produce a wetter, stickier type of wax.
Yeah, I would probably say more of a sticky type. Yeah,
which can be more problematic to remove sometimes, just because you get the stickiness kind of makes the wax kind of just adhere to the canal all the way out, so it can be a bit more of a problem that way. Yeah. Right, what else we got?
So sad that I have to cross the ocean and have an appointment with you. Well, you're still welcome if you're able to. You're still welcome.
Definitely. Weirdly, on the Instagram live that we did earlier, people were asking, is Audiologist Associates ever going to go on tour? Which is something we've never really thought about before, but I suppose if there's a call for it, we could always do it. You never know, might do a US tour or a US leg of the tour about that.
Yeah.
We could tour with ACDC.
ACDC, yeah. That's right.
There you go. So I think what we'll do is, if that's something that you'd be interested in, if you'd like to like a live Q&A where you come along and somebody can ask us questions on tour, it's a bit of a ballpark thing. Somebody just mentioned it. We thought if that's something you'd like to see, pop it in the comment section. Let us know. We'll do it for that.
I said before, I need more than 3 people.
Yes, more than 3 people, unless you live in the same house. In which case, we can probably rock up in your living room and just have a chat to you in your living room.
Cup of tea. Cup of tea.
Well, from Washington State, I just saw in there as well. What was your worst job before you became audiologist? Sandy Cheeks and you too.
I'm going to be completely honest. Call centre.
Oh no, it was tough, was it?
Didn't last 2 weeks.
Oh, never.
Absolutely hated it. Not for me at all. I don't like using the phone now in work now, and that's probably one of the reasons why, to be fair. But I worked in a call centre many years ago, and lasted less than 2 weeks. Wasn't good.
I did probably dishwashing. That was my first ever job when I was 14, 15. I
still do that now.
Like, hello, mate, dishwashing in a, you know what, and it was a fab place. The only thing on the upside was I used to get leftover food at the end of the night. It was a restaurant, and it was an Italian restaurant. It was lovely, lovely food, but that was hard work. Yeah, that was really hard work.
That's a good question.
There was. So Ria Green from Facebook.
Hey, that's my sister.
Oh, there we go. I'll tell you sister. My daughter will be 17 months old when we go on holidays to Spain next year. What's the best tips and tricks to prevent ear infections from the pool? Taylor Green, go on. She was sister.
I'll just carry her around everywhere. It's no problem. I'll make sure she's all right.
Is that your sister now, the 17-month-old?
I'll take care of her. No, I just. She's not going to be going underneath the water, but nothing really you can do. Keep them dry. Don't stick nothing in there. Just towel. Just dry them out with a towel.
Yeah, just making sure it's, and if you can get, I've seen these, you can get for kids though, because obviously they don't tolerate anything in their ears particularly well. If they are going to get lots of splashes in the water, you get this thing called headbands, which just kind of goes down and it's got these 2 big flaps that come over the ear, which are made of neoprene. And that would be helpful as well, just to keep any water out of the ears then if you're going to be in the pool. That's always a helpful one for little ones as well. Yeah.
Another baby wasted one.
Ooh, how's the little grandbaby? Oh, he's doing really well. He was down here on the weekend because it was my lovely mother-in-law, Kathleen, was 75 years old the other day, and you know what? Not once has she ever fallen off a broomstick. And I've got to be honest, she's doing really well. So big shout out to my lovely, my lovely mother-in-law, Kathleen, whose birthday was on the weekend. But yeah, Toby was down on the weekend. He is lovely, as well as Molly as well. So it was lovely to see my daughter and my grandson at the same time. So it was absolutely fab. He's doing really, really well. Thank you very much for asking.
And he's cute as well.
He is mega cute. He's mega cute. You can't quite say grandchild yesterday. He's nearly there. Grandchild is like a Welsh term for grandchild. You can say nonna, which is what he refers to Leah as, who's still a little happy dance in the corner over there, but he hasn't quite got grandchild. He's almost there. It's a long one. So this is from Kathy Carrabinder, and this is from Facebook. So hi from Nebraska. Hi, Kathy. That's a long way away. My husband says that noise from the ear trimmer vibrates off his eardrum, makes him nauseated. Should we have it checked out? I think he just doesn't like me trimming his ears.
I probably, like, the hairs in the ear are supposed to be there. If they're like sticking out, like, inches from his head, then fair enough. But no, they are really meant to be left alone, to be completely honest. And I have not heard of it.
The only time I've ever come across it, we do this a bit like this live on for Radio Wales here in the UK, and something similar to this came up the other day when somebody was hearing a very low pitched sound. It was making them feel sort of panicky and a bit sort of disorientated. Now I was watching a program weirdly a couple of nights ago, and they were talking about something called infrasound, which is very, very low frequency sound, so less than 20 hertz, and the effect that has on people, and it can make you feel nauseated and disorientated. It can make you have a feeling of sort of panic and dread as well. So I wonder whether the ear hair trimmer is doubtful it's making a noise that low frequency, but maybe just triggering something off that might be causing that in there as well. It's quite possibly that.
That's an interesting one though.
Let's have a little bit. My hubby and daughter. Oh, go on, you can read this. I've read those.
My hubby and daughter. This is from Jill McKeefrey. My hubby and daughter have both been told that the ear canal goes the wrong way. Have you ever heard of this before? I've had very, very few patients where they've had their ear canals kind of sloped down slightly, if that's what they mean. I mean, naturally the ear canal tends to go up. But I've had 1 or 2 patients where they have been sort of, bending the wrong way. But I'm not sure if that's exactly what they mean by it goes the wrong way.
It's usually a very pronounced bend. That's usually a pronounced second bend in the ear canal, where you're kind of going back on yourself a little bit. That's what they usually mean by going the wrong way. Just a quick shout out for you all, guys. We are just over the halfway mark. So if you do have any burning questions, Mrs. B is really trying to keep up with them all. But make sure you pop them into the comments. I can see. Make sure you pop them into the comment section on YouTube and Facebook. We promise we'll try and get through as many as we can. Perhaps we'll do a quick fire 5 minutes. Quick answers. What do you think?
We'll try.
Yeah, go on then.
We'll try.
Evening,
gents. A comment from my good lady Lisa. Came up to Portsmouth to see the lovely Miss Taylor Green in March. She just wanted to say hello. Hope you're all well. And Mrs. B makes a killer cuppa. Hello.
Oh,
nice to see you. And it was obviously really, really nice to welcome you into clinic as well as with everybody else that comes in. It's always nice to see people coming down for visits, like wherever you come from, whether it's 2-minute drive or a 2-hour drive.
Do you guys watch other audiologists? YouTube channels. Also, Mrs. B deserves a raise for dealing with the two of you all. Okay, Schmidt. I know it's Mrs. B pops that up there. That's on YouTube. We do. Yeah. We watch. I'd say this. We don't watch. I don't watch everything really regularly. I got to be honest, because there's not time to do it. But probably Neil, Connor.
Yeah.
Nurse Richard. I probably the other one. That's probably the 3 I would probably watch the most out of all of them. I would say probably.
Yeah.
You, Taylor?
Same. Oh yeah, exactly the same. Yeah. There are a few like random ones that pop up every now and then. It's just like music over the top from.
Oh, burning question. What does fair play mean? From Arlene Lazinski on YouTube.
It means when we sort of say, fair play.
Fair play. Yeah, fair play.
Like, that was good.
Yeah.
Like that, yeah.
Yeah, well done. That's fair play. That's good going, right? Yeah.
It was fair play.
Yeah.
Yes.
That's kind of a Welsh-ism, I think. I don't think they got that in England, but it's Welsh. What do you all know about Meniere's disease? From Rose Jones. Oh my goodness, Laura, thank you so much. That is very generous. Thank you so much.
$99.99 donation from Laura.
That's me. Thank you so much, Laura.
Thank you very much. My goodness.
Very kind.
Oh, wow.
What do you know about Meniere's disease? So Meniere's disease is basically, it's quite a complex disease. It was misdiagnosed a lot over the years, Meniere's disease, but it's a buildup of pressure in the fluids inside the actual balance system itself and the cochlea. And if you imagine, this is a really simplistic way of looking at it, but if you imagine these fluids shouldn't mix, imagine like oil and water, so they're not meant to mix, and they're separated by a very thin membrane. If you get a buildup of pressure in that, it can rupture the membrane. These two fluids can mix, which causes you to feel, oh my goodness, so ill. You feel really dizzy. You're sick.
People get really nauseated and sick with it in the cases.
Tinnitus, hearing loss, all sorts of different things. But eventually they will separate back out and that little membrane will repair itself and everything goes almost back to normal.
We almost kind of we do see occasionally with Meniere as well, like a really unique kind of hearing loss as well. We usually see low frequency hearing loss with Meniere's with some patients, which is not very often you see that type of hearing loss. Kind of cutting the words out. It's just too much going on.
We can see the questions on the side coming in, so we kind of scanning the questions. We can see what's coming up. Right. My mum had mastoid removal and suction makes her feel sick. Oh, that does happen sometimes. She's been waiting a year for an NHS appointment. Do audiologists do syringe removal? Is there anything else you can do to help with hearing in the meantime? Right. I wouldn't recommend having irrigation or syringing done on a mastoid. The reason that you feel sick, you are more susceptible to the caloric effect, which is where you get temperature changes which can affect the viscosity of the fluid in the balance system. What you'll find with microsuction, yes, you can experience the caloric effect and you are more likely to do that with a mastoid removal. You shouldn't really have irrigation done because that effect would last longer and you're more prone to getting infections. So I would say if you're waiting for, if you can, Stephanie, if you can get your mum along to see a private audiologist to get some microsuction done, if that is an option for you, that would probably be the best course of action for you, I would imagine. Yeah,
you can also get the caloric effect from irrigation as well. If whoever you see, if they don't test the temperature of the water, if it's too cold, exactly the same happens. You get instantly
Yeah, you could use curettage, which curettage you're going to use a manual tool. It's not always that effective in mastoid cavities because of
such an awkward angle.
It is. It's not always easy to get it out, and the ear canal is a little bit more susceptible to kind of just nicking and causing a little bleeding in there as well. Sometimes if the wax is right on the outside edge, you can do it, but most of the time, yeah, I would see if you can get private microsuction, but see if they can maybe use a fine end, a smaller tube, so it means it not pulling so much air in, so it doesn't drop the temperature quite as quickly.
I think your mum may need to get it checked on a regular basis as well, so it doesn't build up. If it is, you know, quite a build up, because you know the more often you're seen, the less there is to take out essentially.
Exactly.
So it might be a more relaxed one.
Right.
We got a comment from Trainer Beast. Lads, I keep seeing videos about ear cleaners from Amazon. Surely it can't be a good idea sticking things in your ears. We would never recommend it, especially when I say especially. You can get ear tools which have cameras on there. You know, it won't be a problem kind of using those as like a video otoscope where you're just diagnosing whether there's wax in there or not. We would never advise anyone to stick anything inside their ears, no matter how many 5-star rated, you know, the tool has got. That's our personal opinion, to be completely honest. But the only thing we would really, you know, sort of say you could use is just those cameras to see if you have got wax there or not. So try not to stick anything in the ears if you can.
Somebody actually said just earlier, didn't they, about us explaining how to use them properly?
Yeah, this is as using it as a video otoscope. I think is a great idea because it's difficult sometimes here in the UK at the moment to get a GP appointment and know whether you've got wax in your ears. If you can take a look, but it's like I think, you know, people need a bit of training on how to use these things. I mean, we've been sent a few different ones over the years to have a little look at. I think if there was a way, what I always say to people is, look, if you're producing these things, what you need to be doing is producing some training videos so people can actually see how to use them, what to look out for, because what you see on your camera when you're looking through these things is very different to what you see on our videos, because obviously we're using a high-end endoscope, where those are a little bit more basic cameras, but they'll be good enough to see whether you have wax, but be able to position it right and be able to see properly. Do you know what I mean?
It's a good diagnostic tool.
It's a good diagnostic tool, yeah. And I'd be happy to do some videos showing people how to use these things properly and take a look. If that's something that people would be interested in, by all means, you'll drop it in the comment section. As someone who's had bad wax buildups in the past, I only got a camera to check if I need to get it cleaned or not. It's been quite helpful. There you go. Perfect.
Just hit the nail on the head.
That's exactly what I'm talking about. It's just so much easier to just have a quick check yourself, and you're not going to do yourself any damage by just putting on the outer part of the ear to take a look in. Only your elbow goes in the ear. If it's smaller than that, it's a no-no. That was what my mum told me growing up, from Victoria Pickering, and she is absolutely right. Hit the nail right on the head. There she did. That's perfect.
Yeah.
One for you.
Love the video. This is from Laura Barzik. Sorry if I said your name wrong. Love the video that showed both the internal removal view and the view in the exam room that showed what occurs during an appointment.
Yeah, that was a good one.
Do you know what? That one that we put on Christmas time, and it was just typical. We had one patient booked in who was happy to have it done. We filmed on both sides. And it was probably one of the most difficult ones I've had to do in a long time.
It was a tough
typical.
It was a tough one.
Typical.
Yeah, definitely. Hello from Quebec in Canada. Hello, Julie Turcott Bellatet, I want to say that is. I love your videos. It's so addictive and fascinating. I have eczema in my ears and I would like to consult you, but I'm really too far. I hope I'll be able to see someone here despite the bad health system. Yeah, I hope you get that sorted out, Julie. It's always difficult. Eczema, psoriasis, always difficult things to treat inside the ear canal. I actually had a chap in today with psoriasis, and his skin specialist just said, look, that's all you need to do is keep getting it cleaned away. So fingers crossed you'll be able to find somebody in Canada. We did always say we'd like to, we'd always emigrate to Canada. We'd always do that as well. That's another option.
Oh, sorry, I've done that one.
Right. Go for it.
We got another one from Stephen again. Any types of ear conditions you've heard about, not seen, but would like to?
Insects.
Yes,
I'd love to see an insect in somebody's ear.
Not quite a condition, but we don't really tend to see insects in ears, and unless someone's got travelled abroad and has managed to take a bug home with them, we don't really tend to see it in the UK. No, regarding conditions though, Probably not, to be honest.
No.
No.
Nothing so far. We saw a lot. I mean, I used to work for the NHS. You'd get to see a lot of the ENT. Then you get to see lots of weird and wonderful things in the ENT. So there's nothing really I could think of off the top of my head that I would like to see.
No. Oh, I didn't realise it changed. Sorry, I was looking.
Oh, that's right.
On the Asian earwax channels, often a spade is
Yes.
used to separate skin from the ear canal. Why is a tool not being used by European audiologists? I'm only going to assume that these channels are being created by, and I don't know this for definite, but I'm assuming they are actually used in hospitals, more than likely there, and they may be, what's the word?
ENT, you're doing it under anaesthetic.
Anaesthetic, because like we can't touch the ear canal, let alone you see these videos when they're just going down and they're scraping down. It's so red when you see it afterwards. And
Asian earwax, it's all down to your genetics. So Asian earwax is very, very dry as well. So it's a very different type of earwax to European earwax. So European earwax meant to be a little bit more soft, a little bit more sticky. Asian earwax is very dry, and you'll see those layers coming away there. So that tool is really handy for that type of wax. For us, European audiologists, probably wouldn't be as useful. You would just end up spreading like a butter knife over the canal wall, I imagine.
Debbie, I got a bee stuck in my ear once.
No, oh, Debbie.
Where was you?
I know, goodness me. We got so excited the other day because somebody phoned up and said they thought they had a fly stuck in their ear. I was like, time to come down now. I want to see now.
Cancel everywhere.
But no, it wasn't. It was not even it. What's the worst? Oh my goodness, we've seen Ripples in the Waters on YouTube. What is the worst injury you've seen after an ear cleaning? We're seeing more now.
Yeah.
Why have you seen more?
We're seeing more now because people are not. What we're seeing is there's a lot of earwax practitioners just popping out. There's been loads recently who are people who I've seen tattooists, beauty salons doing earwax removal. I've seen. Pharmacies are popping up, and people with very little training, sometimes no medical training whatsoever, are doing one of the most invasive procedures that we can do. It's one of the most dangerous procedures we can do as an audiologist. And I am seeing ear canals that are there's blood, there's dry blood everywhere. It's irritated, it's swollen, it's red, it's aggravated. I've seen some really butchered sounds. It's a bit far, barbaric. But I've seen some really, really nasty stuff coming through recently.
It's not nice to see because we've also then, when we are having to try and deal with that afterwards, then like this patient's already in discomfort and pain with it, and then we run the risk then of that bleeding again, essentially, once it's cleaned out.
This is a difficulty. It's knowing as earwax professionals and as trained professionals, like you see a lot of the guys here on YouTube and gals here on YouTube as well. But what you'll see on there is that we know what needs to come away and what needs to be left behind. And I think this is where the big difference is. I say that if you look at an ear canal textbook or you look at an eardrum on a textbook, it looks perfect. You never ever see that ear canal or eardrum in the real world. Everything looks different. Everything's got a slightly different quirk to it. And it's knowing what a quirk is and how to identify the structures are still there. They just don't look like what you'd expect. And that comes with experience. And it comes with having a really good underpinning medical knowledge of anatomy and physiology and everything else of that ear. So yes, always do your due diligence. Ask questions about the person you are potentially allowing in your ear canals. We do not want anyone in there that doesn't have the appropriate background.
Doing research.
Yes.
Taylor, what governing bodies should people be looking for when they're booking wax removals? Who should a good audiologist be registered with?
So an audiologist, especially in the UK, will need to be registered with a company called HCPC, which is the Healthcare Professions Council. We are also a member of BSHA, the British Society of Hearing Aid Audiologists. Not everyone will be under BSHA because you don't need to be under BSHA to do all this, but it's an extra qualifications.
It's an extra sort of professional registration that you can have. If you've got somebody that's registered with the Healthcare Professions Council, BSHA, or the BAA is the other one, then you're probably onto a good audiologist there.
If you've got none of those, cancel your appointment.
Great. From Facebook, one because we were Steve Nixon question. I'm 80 years old. Oh, well done. I'm now just having earwax problems. Never had it before. Is my age the factor here? Probably. You are far more likely to get earwax problems as we age.
Yeah.
Basically, we don't produce as much oil in the ear canal. So what happens? The earwax becomes drier, becomes stickier, and it starts to stick and cause more problems. So yeah, it is more prevalent as we get older.
Yeah. The other thing we also see as we get older, the cartilage of the ear tends to soften, and sometimes you tend to see the ear canals will kind of collapse slightly. So yeah, that could be another reason why it may be building up quicker, possibly. We got Kyoko Hickman. I had a flu last month. I wanted to pop my ears a lot. Is it because there was there's nothing else to there's nothing else on the end of that one? Sorry,
because it was waxed.
Possibly. I mean, it's not unknown, but chances are, if it happened straight after you had the flu, then it was more than likely going to be a middle ear issue, so behind the eardrum. So your eustachian tube tends to get kind of blocked up, especially if you have problems with your sinuses at the same time. And you can build up with fluid, which is called middle ear effusion or glue ear. That happens very, very regularly, actually, with colds and flus. We're seeing it quite a lot at the moment. I'm seeing quite a few people coming through with it. Saying that they're really blocked up and
don't forget, guys, you are in your we're probably in the last 8 minutes or so. So if you do have any questions, drop them in the comment section below. What we'd also really love you to know from you guys, is this something you would like us to do again? Would you like us to do another live where you can throw all your questions out to myself and lovely Mr. Taylor Green? If that is something you would like to see, then make sure you drop it in the comment section below and we'll know whether to do this again for you guys.
It's been really interesting, actually.
It's been quite good.
This is my first live video.
I know, this is Taylor's first live. So yeah, just to see how many people engage was absolutely brilliant.
Yes, thank you for joining us.
So Polo5924 from YouTube. So what are your thoughts on why people love watching this sort of stuff? Earwax, manky feet, cysts, and blackheads. And is it fair that I've bunched you in with all of those? I
think we're perfectly fit into all that.
I think we are as well. I think this is very much a rabbit hole that people kind of fall down, and I think it starts off with pimple popping.
Yeah.
Somebody was saying the other day they watched like a hoof cleaning.
Kelly watches them quite often.
What is a hoof cleaning?
The hoof GP.
Hoof GP.
Okay.
So they basically
like cows and
cows will have cysts in their hooves and they like bursting up when they're shaving, and it's a bit gross, but
Will you say hello to them? Sorry, Taylor.
The lovely Kelly, which is my partner. Hello there. If you're watching, she probably put the baby to bed.
There was a beautiful statement on earlier from somebody about how gorgeous your lady was, and they wanted to know whether or not how long you've been together, whether you were married, etc., etc.
We've had audition up in
thank
Candy.
you, Candy.
Sorry, we've had another Canadian donation. Thank you very much.
Candy.
You don't have to send money, guys. Honestly. Going back to again to Kel, we've actually been together 10 years, believe it or not.
No.
And we are still not married. Getting there though. Maybe one day.
You heard that here first, Kel. I will hold him to that.
Maybe one day.
Thank you all for your 1,000 episodes of entertainment, education and laughter. Mrs. B and team, we salute you for what you do behind the scenes to thousands more you go. Thank you so much, Crystal. That's a lovely thing to say from YouTube.
Shout out.
Okay,
I'm gonna take the questions away.
We're gonna do shout outs. Okay, we're gonna do quick shout outs.
Shout outs.
Alternate.
What are we doing? Just from
thank you, KY. Just do it $50.
Another one again.
Thank you so much.
Thank you very much.
Right, okay, shout outs. Okay, Sandy Cheeks.
Nancy Gonsalves.
Hazel Fleming on YouTube.
KY, another pint for you.
Thank you, KY. That is amazing. Oh my goodness. Superlink Fighter. Hello, Mr. Hello, Taylor. Thank you so much.
Stuart from London.
Derek Scollin from YouTube.
Lisa to pop the question, Taylor. We got Rita 123747.
Okay, Heather. Oh my goodness, going so fast. Sandra Molina, Daniel Niprath,
Heather Foot,
Amanda Stewart,
Siobhan.
Siobhan. Happy
Siobhan.
Sheila Rouse,
Superlink Fighter.
Stephen Alaxon,
Stephen, Zero BS Tolerance.
Hello,
See you in the
Zero.
comments.
They've been around for a long time,
Long time.
Zero. Teddy Cakes.
Salute. Oh my God, they're flying in now. Tina Evans is my nan. Hello, nan.
Hi, Nanny.
Hello, Nan. Cindy Streeter.
Victoria, Siobhan, Melody, Caitlin.
Ripples in the Water, Lucifer, Morningstar, Anna Break, Karen's craziest sister. Oh, there we go. Marina.
Oh.
Zero.
There's my mother.
Laura Kahn, Chaos Creations, Anne Vanderberg, Rebecca Bowd. That one.
Gemma, Alexandra Mahina. Hey, sorry. Blake Blatter.
Linda Cruz, Samantha Hoover,
Superlink Fighter.
Melody Adams, Haggy Lady,
Susan Perry.
A. Taylor. Any relation?
Kate Smith.
Caitlin Schmidt, Kate Smith, Morgan Kirkendall. Oh my gosh, Shani's Burgers, John Homer, Oracle 1321, Lisa, Natalie Soma. I came for the eggs. There we go. Kathy Sanchez,
Kathy, Ron Lippett,
Moose Foster, Mons Foster,
oh yeah, a hectic hobbyist,
Stephanie Hensman, Hazel Woodward, Tammy Ray.
Yeah, guys,
why do we appreciate all these people? Well,
because they are awesome. That's why we appreciate
you without you. That's
exactly right. Exactly right. And the thing is, you guys have pushed this channel in so many different directions, which has been absolutely fantastic. And we love you all the bits for doing it. And you're the ones that actually develop and form the channel to what it has become today, from rather than me doing boring voiceovers at the beginning. This has all changed over the time. So I keep plugging it, guys. That's absolutely fantastic. Taylor Green, why do you love everyone that's doing the bits and pieces?
Exactly the same. From day one. When I first joined, you could obviously tell I was super nervous about it, but everyone's been absolutely lovely, to be fair. And that's why I'm getting so good at these, because I wouldn't say I'm good at them, to be fair, but I've got better.
Taylor's awesome. Taylor's awesome at these now.
Thank you, guys.
Lots of people saying that they need more live streams.
But if that's something
I'm happy to do more.
I'm happy to do more. If you want us to do more, that's not a problem. Perhaps we should schedule on a regular basis.
Can people now just tell us what they want to see from us? Get them in the comments.
Okay, go on then. We're going to do some brainstorming, guys. What would you like to see from us? Need a collaboration with you guys and Connor. Yeah, quite possibly. That'd be a good one to do. Yeah.
So we've spoken to Connor before. He is up for that.
We have. I've spoken to Connor, and Connor's up for a collaboration. Perhaps we could combine the two and do a live Q&A, and we'll have myself and Taylor on one side, Connor on the other. You can ask us all loads of questions. You have 3 audiologists for the price of 1.
Mr. Taylor's first appearance is in episode 500.
There you go.
Everyone's going to go back and see how nervous I am now. I'm doing it.
So was this live as tough as old boots? It was easier than we thought it was going to be.
It was easier than we thought, to be fair, because we were kind of stressing about it a little bit.
Monthly live streams would be lots of fun. Perhaps that'd be an idea for the future, Mrs. B. The monthly live streams. That would be a good one to do.
Tips with Taylor is going to be coming back as well. We're doing it kind of on a what were we doing it on?
Ad hoc.
Yeah.
When we get time.
It will be,
time.
Not weekly thing, but it will come back.
So Inspect Each Other's Ears came out. Oh my God. A live once a month. Don't want to be too pushy.
Would you guys get bored if it was once a month?
I don't know. Live stream with quizzes. We did that over lockdown. That went down really well. My goodness me, what have we got? One of my favorites when you call it Taylor's camera and his reaction. Do you check each other's ears? Yes, we do. I always ask Taylor to have a quick look in my ears, because it's always good.
I normally give it a good clean out front, to be fair.
Yes, that's it. Yeah, because my genetic I do produce a bit of wax anyway. Okay.
I've done mine a couple of times, actually.
I've done a few of yours. Yeah, that's right. Yeah. 1 year is not enough for a live session. 1 hour. 1 hour is not enough for a live session. More patients' reactions during removal. Yes, we will try. It's difficult. It's just trying to get patients to agree to it.
Yeah.
With patient it's patient confidentiality, but we do try. Brilliant. These are such lovely comments. Thank you so much.
Put some comments up now.
Come on now. So never bored. That's always good. Congratulations. Thank you so much, Tracy. I have actually seen every YouTube. Well done. And Kathleen Cannon Talento from YouTube. Thank you so much.
One of the few. Tips with Taylor is awesome. Thank you.
It was the twist. It was got
to make it fun. You got to make it enjoyable.
Heather used to cut a year off, I think.
Yeah, when did Blue stuff come out? I have no idea, Heather. That's a new one on me. I'm so sorry. Love tips with Taylor. Lots of good love tips with Taylor. There you go. Oh my goodness, lots of stuff on here. Lots of stuff. The whole UK group would be great. Neil Connor and the Wax Wizard. God, that would take some putting together. Listen now. I'm up for it, okay? If I'm up for it, you guys need to pester the rest of them to be up for it as well. And I promise you, if the rest of them are up for it, we will put it all together in one big UK Audiologists live stream. How about that?
You up for it, Taylor?
Yeah.
I'm up for it.
I'm up for it.
Yeah,
so
I'm
you
keen.
guys is to go and pester all the other audiologists in the comment section. Say, look, Reese and Taylor from Audiologists are throwing down the gauntlet. Come on to a live stream with us and answer some questions.
Doesn't have to be you related. You can just be. We can just go off on a tangent and just talk about anything.
That's it.
So we come up to an hour now.
Mm.
So it's got 15 seconds left.
Oh my God, that's not a lot. How amazing! I love you guys. Thank you, Michelle. Thank you so much.
Yeah, thank you so much for watching.
That's my son-in-law.
Yay, Jake! How do you
Nice
do?
babies, we bring back the potato. As Deborah says, I don't like potato when I shave my beard off. I'm an attractive potato, but a potato nonetheless. There you go. Love watching you both. Oh my goodness me, there's some love. When I was not enough, I know, guys. It's the way it flies by from our end. We've just gone over the one hour schedule a bit, but yeah, it's something that we do enjoy the lives because it's lovely for us to interact with you guys in real time rather than sort of seeing your comments post video. But yeah, definitely. Congratulations, enjoyed the live feed. Well done. Thank you, Mr. B, for doing Microsoft Steve. Andrea, no problem, Andrea. It was lovely to see you again. I encourage you 1,000 for. Oh my goodness, there's so many. Live
How long have we got left, guys?
We're done.
We're over an hour.
Let's wrap this up.
Right,
We just keep going.
Let's keep it going.
We're going to get their hopes up now.
So, play the game Operation. I'd love to do that.
Operation off.
Imagine if we have Operation Off with the rest of the audiologists from the UK. We'll have an Operation tournament. So there we go. But guys, thank you so much for engaging with us again in the live. We love the fact that you guys are so engaging on the channel, and you know we love reading all your comments and all the lovely things you've got to say, which is fantastic. You make the channel, so thank you so much for being the amazing, supportive, really just approachable and friendly audience that you are in the comment section. You make everyone feel really welcome, and we love that about you all. We have, I want to say, we have the best community on any social media channel out there because everyone is so lovely and supportive to everyone else. Nobody is disrespectful or nasty in the comments, and we love that about you all. So thank you so much. Closing tight. You can close out the live.
Awesome. I love watching, and we've loved having you. To be completely honest, guys, I'm really sorry to say this is actually going to be us signing off, checking out, going home, putting our pajamas on, having a shower first, and just jumping into bed soon because I'm tired.
It's been a long day. Well, guys, thank you. We will definitely do this again with you soon. But as always, take care of yourselves.
Take care of your ears.
And take care of one another. And we'll see you again soon.
Bye.
Bye everyone.